Throughout my extensive career, I have provided clinical guidance to countless women in the sophisticated art of autogenic intimacy, commonly referred to as self-pleasure or digital stimulation. It is, indeed, a profound privilege to do this work. Many patients present with various sexual health challenges, and frequently, modifying their approach to self-touch serves as a cornerstone of the therapeutic solution. For women over 60 seeking evidence-based advice on self-pleasuring, please remain attentive. I am Dr. Lily Stones, a gynecologist and intimate health psychologist with over 30 years of experience in female physiology. My objective is to empower you to achieve the most fulfilling intimate life possible. This discussion is dedicated to the sophisticated, open-minded woman who desires enhanced pleasure, satisfaction, and a higher frequency of orgasmic release. Please remain engaged until the conclusion, where I will detail a comprehensive protocol for digital stimulation, including a final navigational move that is often the determining factor in success. Before we proceed, I invite you to share your viewing location and current time in the comments. Your visibility helps foster a community of shared discovery. Furthermore, for those wishing to deepen this somatic journey, I have authored a clinical guide entitled The Art of Touch, which explores the full therapeutic potential of the hands. Whether utilized during foreplay or as the primary event, digital stimulation is profoundly efficacious when executed with precision. The human hand is an extraordinary instrument. It possesses unparalleled flexibility, capable of adjusting pressure, angle, and scale. From a single digit to 3, this adaptability provides far greater control than any rigid device. I want to offer a crucial clinical reassurance. If your body has undergone physiological changes, if you experience cirrhosis, dryness, heightened sensitivity, or a perceived decrease in responsiveness, this does not signify the end of your capacity for pleasure. It indicates that your body requires a modified clinical approach. Once you master these refined movements, you will find that profound satisfaction remains entirely accessible. Think of this as acquiring a new somatic language. You understand the fundamentals, but we are now introducing the nuances, subtle rhythmic shifts, gentle tactile engagement, and the secrets that transition an experience from adequate to extraordinary. Every technique shared today is entirely private, intended for exploration at your own pace, free from external pressure. This is a dedicated period for self-connection, designed to leave you feeling satisfied, vital, and more attuned to your body than ever before. The foundational protocol preparation and priming. Before physical contact is initiated, several powerful steps must be taken to prepare the neurovascular system and the mind. This preparation is the difference between a perfunctory act and a truly restorative experience. Clinical hygiene and safety. Begin with the fundamentals. Thoroughly cleanse the hands with warm water and soap, paying particular attention to the subungual areas under the nails. Post-menopausal tissues are significantly more delicate, atrophic, and even minor abrasions can cause discomfort or lead to secondary infection. Ensure nails are short and smooth, and remove all jewelry to create a safe, non-irritating environment for the tissues to relax. The necessity of lubrication post-menopause. Estrogen depletion leads to thinning of the vaginal mucosa and decreased natural lubrication. Attempting to push through dryness is counterproductive. Recommendation: utilize a high-quality water-based lubricant for daily use or a silicone-based option for prolonged sessions and a silkier texture. Some women prefer organic coconut oil for external vulvar massage. Clinical contraindication: I strongly advise against the use of saliva. It evaporates too rapidly and can introduce bacteria that increase the risk of urinary tract infections, UTIs. See neurological priming. Pleasure cannot be effectively achieved in a state of sympathetic nervous system dominance, stressed. If you are holding tension in the shoulders or pelvis, your pelvic floor muscles will reflect that stress. Inhibiting arousal. Techniques: spend 2 to 3 minutes in diaphragmatic breathing, as inhale through the nose, exhale slowly through the mouth. Visualize each exhale softening the deep pelvic musculature. This shifts the nervous system from a cognitive, thinking mode to a somatic, feeling mode. Biomechanical positioning. For women managing stiff joints or arthritis, Positioning is key to preventing discomfort from overshadowing pleasure. Use supportive pillows beneath the hips or knees to optimize angles and reduce strain. Do not hesitate to pause and stretch the hands. The goal is enjoyment, not physical performance. 2. Move oncey. The priming of the canvas. Teasing. A common error among older adults is rushing the arousal process. While a faster approach might have sufficed in younger years, the post-menopausal body operates on a different vascular timeline. Blood flow to the vulva is slower, and arousal requires a more deliberate build-up. The techniques start away from the primary genital sites. Allow the fingers to roam over the thighs, abdomen, and hips. This is not a delay, it is vascular priming. Each stroke activates nerve endings and directs blood flow to the pelvic region. Action. Gradually move closer. Gently press the palm against the vulva over soft fabric. Implement a rhythmic pulse and release motion. This builds waves of anticipation and engorges the labia and clitoris, ensuring that subsequent direct touch is not only comfortable but highly effective. The more time allocated to this priming, the less physical effort will be required to achieve climax. C. Move 20. Clitoral awakenings. The gentler invitation. Once the body is vascularly primed, focus moves to the clitoris. After 60, this organ often requires a softer, more nuanced invitation. The technique. Begin with the clitoral hood, the protective fold of skin. Rather than direct contact with the glands, rest the fingertip to the side and execute minute circular movements smaller than a coin. Subtlety is paramount. You want to engage the nerves without inducing sensory overload or irritation. Variation. Try around the clock motions, touching lightly at the 12, 3, 6, and 9 o'clock positions. Broaden your touch using the flat pad of the finger rather than the tip if sensitivity becomes too intense. Lubrication. Check. Add more lubricant here to ensure a soft cushion of glide, allowing the clitoris to focus entirely on pleasure without the distraction of friction. EV. Move 30. Internal exploration. Fullness and angle. If the body is responsive, you may explore internal stimulation. This provides a dimension of pressure and fullness that many find satisfying. The technique. Ensure the digit is abundantly lubricated to protect the delicate mucosal lining. Place the fingertip at the vaginal introitus opening and pause, allowing the pelvic floor to relax. Slowly insert the finger only as far as is comfortable. The come hither motion. Gently curl the finger toward the anterior wall, the belly button sided, approximately 1-2 centimeters inside. This targets the anterior vaginal wall, an area rich in sensitive tissue. Move in small, upward arcs. This is about flexibility and finding the correct angle, not rapid thrusting. If any discomfort arises, return immediately to external touch. V. Move 40. Blended stimulation. The G-spot synthesis. For many women post-60, the most profound release occurs when multiple sensory pathways are engaged simultaneously. The technique, while maintaining the internal come hither rhythm on the anterior wall G-spot area, use the other hand septum or the thumb of the same hand to provide simultaneous external clitoral stimulation. This blended stimulation often unlocks a richer, more complete, orgasmic response. Crucial insight: once you identify a rhythm or pressure that elicits a strong response, maintain consistency. Avoid the temptation to suddenly change the pace or intensity, as this can interrupt the neurological build up to climax. VI. Move 5. The lighthouse secret: steady state navigation. The most frequent mistake made during the plateau phase of arousal is an abrupt change in stimulation right as climax is imminent. The body requires unwavering consistency to cross the threshold. The technique, I refer to this as the lighthouse secret. Once you identify the specific stroke or rhythm that your body is melting into, do not deviate. Maintain the exact pace and pressure, acting as an unwavering signal guiding the body into release. Breath integration: continue deep, calm respiration. This prevents the pelvic floor from over-tensing and allows the pleasurable contractions to propagate through the entire body. If the resulting orgasm feels qualitatively different, perhaps warmer or softer than in younger years, embrace it. These releases still provide essential healing neurochemicals and affirm your somatic vibrancy. VICI. The clinical importance of the afterglow: the journey does not conclude at the moment of release. What follows is the afterglow phase, which is clinically significant for nervous system regulation. Immediately following pleasure, the body is flooded with hormones that reduce systemic stress, lower blood pressure, and calm the autonomic nervous system. The ritual lie back, close your eyes, and place one hand on the abdomen and the other over the heart. Breathe deeply, allowing the warmth to distribute through the body. This is an act of somatic gratitude. For women in their 60s and 70s, this integration step is profoundly healing, reinforcing the truth that intimacy and aliveness belong uniquely to you. I encourage you to share in the comments which move L of 1, 2, 3, 4, or 5 of resonates most with your experience. Your narrative serves as a vital resource for other women on this journey. Remember, your body is not a relic of the past, it is a living, responsive instrument deserving of pleasure today.